Okay, now we're going to demonstrate how to take an intraoral photo. You definitely need to, it's a two-person job. You can see the second person is drying the tooth with the air water syringe. You want to make sure your tooth is fully dried. Retracting the tongue and the cheek with my 2 fingers. I'm going to remind my patient to breathe through her nose so my camera doesn't get foggy. Alina, please breathe in and out through your nose. I am placing my camera parallel to the tooth, and also it's sitting against the opposing arch. That'll help you keep your hand steady. As you can see, the decay is very visible. Everything that you need to see is there. Now we're going to move on to demonstrate how to take a buccal surface intraoral photo. What I find very helpful is to just place the camera against the cheek. If you want to see how I'm placing the camera against the cheek, it's sitting against the cheek. I think it looks like we need to dry that buccal area a little bit more. She doesn't have a cavity there, but I just want to demonstrate how easy it is to capture that buccal surface. Let's do it one more time. Perfect. And now we're going to demonstrate how to take a lingual surface photo. Okay, push play. I'm going to demonstrate the top and bottom since it's different. For the top, just place the camera parallel to the surface, and I'm holding it against the tongue to help me stabilize it a little bit. I'm going to get a little closer and dry the lingual surface a little more. Perfect. Now we're going to move on to the lingual surface on the lower. Can you push play? Thank you. Open bit. Again, don't forget to breathe in and out through your nose, okay? I'm holding the camera parallel to the lingual surface, and it's sitting against the tongue to help me stabilize it a little. Again, she doesn't have a cavity there, but if she did, you would be able to see it, except I think it's a little wet, so I would want to dry it more. So just dry the lingual. Okay. Make sure that the tooth isn't so shiny, that way you could see the decay if it was there. Okay. If you need to, you could use cotton rolls to keep the area dry. You could, can you push play? I found it sometimes it's helpful to place a cotton roll here in this area or here. But at the same time, if the child's mouth is smaller, it'll just be on the way. So if you have somebody helping you to dry it with the air water syringe and you're moving the camera and placing it out where it goes, it's pretty easy and quick. What else can I show? Did we do the buccal on the top or the bottom? The bottom. One of the harder ones we find sometimes are the posterior molars buccals. So I'm going to show a technique for that. What you want to do is have the patient turn towards you. Turn this way, Alina. Close their mouth. The technique here is have them close down a little bit. That way you could reach that buccal area. So like I said, the technique here is have them close down, because if they open, the tissue is going to be in the way. Open it just a little bit more. Just a little bit more. This is the tissue back here that you want out of the way. So close a little. Get closer. If there was a cavity there, you would be able to see it and capture it quickly. I think we're done.